Hi, I'm Jill Bebout. I'm a nurse practitioner, school at West Texas State University. This is Melanie. She is a willing participant of the head to toe exam, physical head to toe exam. So I've washed my hands, I've raised the bed up to a level, and we've closed off the curtains for privacy. And so we're going to get started. So prior to the exam, we came in and we did the second cranial nerve, which is the optic evaluation of the optic nerve. So we did a Snellen's exam with her glasses on to do a correct visual acuity on her. And later on, through the assessment of the eyes, I will demonstrate how we looked at the red eye reflex and also the optic disc. We also did the olfactory test with a cotton swab prior, and Melanie was able to identify the first cranial nerve as the alcohol swab. Okay, so we're going to get started. So Melanie, what I'm going to do first is I'm going to look at your head. Okay, so when I look at her head, I look for symmetry and everything looks asymmetrical, and I'm going to palpate for any lesions, nevi, or abnormalities. Any pain with this?
No pain.
Okay. So hair is nice and clean and intact. I don't feel any lesions or tenderness. And can you put your chin down, turn your head side to side, do a range of motion? No tenderness in your neck?
No.
Okay, great. So now I'm going to look at Melanie's skin. Everything looks great and intact. I'm going to look for any lesions. Do you have any bumps or any rashes or anything, Melanie?
No.
That you need to tell me about?
No.
Okay, we'll go through that. So I'm going to basically discuss the ABCDs of the skin. We're going to look for any asymmetry and any changes in the color of the lesions, if I see any raised bumps or lesions on the skin that may be abnormal. Okay, so Melanie, now we're going to do a evaluation of your eyes. Okay, so can I get you to take your glasses off?
Yeah.
Okay, so this is evaluating the optic nerve. And so first of all, what we're going to do, Melanie, is I'm going to test if you can look forward for me and open your eyes straight, and I'm going to look to see if our pupillary reaction is equal. And I'm going to flash this by. I'm looking for direct and consensual. Direct is the change of the pupil with the light, and consensual is the change of the other eye when the left eye dilates. Okay, so look straight ahead. Okay, I see great changes there. Went from about a 3 to a 2. Okay, and on this side, look straight ahead. Great. Great, consensual and direct. Okay, I'm going to have you look straight ahead, Melanie. I'm going to look at the red eye reflex. Okay, so the red eye reflex is a good indicator of normalcy. When you don't see a red eye reflex, it could be a cataract or it could be some glaucoma. It's not an abnormal finding if you don't see a red eye reflex. Okay, so Melanie, what I'm going to have you do is I'm going to have you look straight ahead. Okay, I'm going to just touch the top of your head with my hand, and I'm going to go in. Okay. Is that too bright?
Mm-hmm.
Okay. Look straight ahead. Okay, that was great. Okay. Optic disc look normal. So I'm going to put this rail down. Hang on just a second. Thinking of patient safety.
Mm-hmm.
Jump out of bed.
Yeah.
Okay,
So it won't roll out.
So again, we're testing the optic nerve, which is the second cranial nerve. I'm going to look here. Good. Okay. Disc look normal. No cupping. Everything looks great. Okay. So now we're going to test for cranial nerve number 3, which is the abducens. Okay, so I want you to raise your eyes up and look down. Okay, look side to side, which is the abducens, which is cranial nerve number 6, and also can do the 6 fields of gaze. All right, so I want you to look straight ahead, okay, or look at my nose. Okay, 6 fields of gaze helps you look and see if there is any divergence of the eyes and any movement that they can't make bilaterally. Okay, look at my nose, look at my finger. Okay, just follow my finger down, up, Great. Okay. Looks like everything's intact. She's able. You can put your glasses back on. Sorry. Does that make your nose itch? Sorry. Okay. So her eye exam looks great. I don't see any fundal changes. No bulging disc inside. Okay. So now we're gonna look at your ears. Okay, Melanie. So what I'm looking in the ear is the tympanic membrane. I'm looking to see it needs to be gray and shiny gray with a good cone of light. Okay? So here we go. We're going to look inside. Okay, great. Just a little bit of wax is all I see. This is cranial nerve number 8. The acoustic nerve, which we'll go over in just a moment, is the hearing. Good. Okay. No redness, indicative of otitis media, which would be an inflammation or redness or bulging of the disc. Okay. So also I'm going to visualize the pinna. I'm going to look for symmetry of the ears and the eyes, which are both symmetrical, atraumatic. Visualize the ear, any tenderness here. Nope. Okay. Palpate the pinna. Okay, great. All right, so now I'm going to finish the facial exam. So first of all, I'm going to palpate Melanie and tell me if you feel any tenderness.
No.
Okay. Any tenderness here? No. Okay. I'm going to feel here for pulses. Good temporal pulses there. Okay, now we're going to test cranial nerve number 5, which is the facial. So I want you to puff out your cheeks. Good. Okay. I want you to smile. Good. Both symmetrical and even. Cranial nerve 1, 2, 3, and 4, 6, and 7 we have done. We will do the 8 in just a moment. So let's go ahead and finish up with cranial nerve number 7, which is the trigeminal nerve. So we're going to have Melanie close her eyes, and we're going to feel, she's going to tell me if this is soft or dull.
Dull. I'm sorry. No, that's soft.
Okay, I was like, oh. Soft.
Soft.
Okay.
Soft. Soft.
Okay. Tell me if they're even on both sides.
Even. Even.
Okay. Tell me if this is dull.
Dull.
Is it sharp?
Yeah, that one's sharp.
Dull or
yeah.
sharp. Okay.
Dull.
Are they the same?
Mm-hmm.
Okay, good. Okay. So on through the cranial nerves, so that was cranial nerve number 7. We'll do the acoustic. Okay, we're going to do the Rene exam. So the Rene exam is basically for air conduction to bone conduction is what we're testing for. So the Rene, what I'm going to do is I'm going to tap this, okay, and I'm going to hold it underneath, and then I want you to tell me when you stop hearing it. Okay? All right. Ready? Mm-hmm. Wait, I need to tap it more.
There.
Okay, good. So a good conduction should be a 2-to-1 ratio. Ready?
There.
Okay, good. Now we're going to do the Weber test again for testing for cranial nerve number 8. So the Weber test, I'm going to actually put this on your forehead, and I want you to tell me when you stop feeling the vibration. Okay? Ready?
Stops.
Okay, good. All right. So Melanie has a good air conduction in relation to bone conduction. So her hearing seems to be normal. Also, I'm going to do a whisper test, Melanie. So I want you to close your eyes and tell me what I'm saying.
99.
Good. And again.
99.
Good. Okay. And it's both equal on both sides?
Mm-hmm.
Okay, good. Okay, so that finishes cranial nerve number 8. Now we're going to talk about cranial nerve number 9, which is the glossopharyngeal. Okay, Melanie, so I want you to stick out your tongue. Say ah. Good. Good. Okay. All right, and so cranial nerve number 10 is the vagus nerve. So I want you to cough. Good. Good gag reflex. Okay. Cranial nerve number 11, which is the I want you to, yeah, lift your shoulders. Good. Good. Spinal accessory. And number 12, I'm sorry, the spinal accessory. Good. And number 11, we did 11 already, right? Okay. All right. So those are the cranial nerves, basically. We've gone through all of those. Yeah, 10 was the, okay. So now, we've done the eyes, we've done the ears. Now let me look inside your mouth, Melanie, and I want to look at your tonsils. Okay. So new cover here. Let me go grab one here on this side. Okay, I'm going to look at the back of the throat, and I'm looking for redness. I'm looking at the tonsils should be at least 1.5 inches apart. There, the cobblestoning to the back of the posterior pharynx is a normal finding. I'm looking for any redness, tenderness, swallowing difficulties. Okay, so I don't want to use a blade if I don't have to. So I'm going to see if I can visualize without it. So go ahead and stick your tongue out. Good, good. Any soreness to your throat? No. Okay. And move your tongue from side to side. Let me look at it and lift it up. I'm looking for any lesions, nevi, or sores. Good dentition. Looks like you've done great teeth cleaning, and so that's it. So now I'm going to test the nodes, the lymph nodes. So first of all, what I'm going to do, Melanie, is I'm going to test. If I'll have you sit forward for me.
Mm-hmm.
Okay. I'm going to palpate for the occipital nodes. Any tenderness?
No.
No? Okay. I'm going to come up here pre-auricular.
No.
Okay. Auricular.
No.
Okay. Tonsillar.
No.
Okay. Submandibular.
No.
And the submental. No? Okay. We're going to palpate down the posterior and the subclavicular line. I don't feel any. I want you to raise your arms up. I'm going to test for any maxillary tenderness or nodes. No? Okay, I'm going to have you lay back, and I'm going to test for any lymph node swelling in here, adneXal swelling, tenderness, any swelling or tenderness? No? Okay. Okay, great. All right, I'm going to sit you up. Mm-hmm. Okay, now I'm going to test for the thyroid. I'm going to feel of your neck. So if I can get you to lean forward and look up for me. So I'm going to palpate, and I want you to swallow. Good. Okay. So I didn't feel any type of swelling or deformity, any pain with that exam. No?
Okay.
Okay, good. All right, so we've done the eyes, the ears. Now let me look at your nose. Okay, so I'm going to be visualizing the nares to see if there's any redness or discharge. Okay, look straight up. Okay. It looks intact. Good. No swelling, tenderness, or discharge. Everything looks good. Okay, we've looked at the throat. We've talked about the lymph nodes. So now we're going to go on to the chest or the thorax region. So I'm going to lay you back, Melanie, first. So what I want to do first with the chest is I want to examine it. It looks symmetrical, and I'm going to feel, and I'm going to see if I can feel any heaves. I don't feel anything here. Okay, great. So now I'm going to tap first, and I want you to just listen to all ranges. Good. Makes sense. Okay, now I'm going to sit you up, Melanie. Okay, and I'm going to do the same with the back. So I'm putting my hands, I'm looking for any changes in expansion. So take a deep breath. Good. Okay, and again. Okay, and while I'm back here, I'm going to test for CVA tenderness, which could indicate some kind of kidney tenderness or abnormalities of the kidney. So tell me if you feel any tenderness, Melanie.
No.
Okay, good. All right. So now what I'm going to do, if I can have you continue to lean forward, okay? I want you to say 99. This is
99.
okay.
99.
And I'm
99.
feeling for any vibrations or
99.
tactile firmness.
99.
Now back to the front.
99. 99.
Okay, good. Now I'm going to listen. We've palpated and we have felt, and so now I'm going to listen with my stethoscope for lung sounds. Okay, make sure they're all clear. So just relax. Take a deep breath in. Off to the side here. Yeah, it's okay. Deep breath in. Good. Good. Lung sounds are nice and clear. Now you lean forward. Again. Lung sounds are equal throughout. Good. Okay, Melanie. So that's all for the lung exam. So now we're going to go on to the abdomen and evaluate your tummy real quick. So first of all, I'm going to feel the liver, okay? So what I'm going to do is I'm going to be palpating down, arms to the side. I'm going to palpate down and I'm going to listen for dullness, and it needs to be 6 under. I'm listening for dullness. Good, there. Okay, I'm going to do a tuck under test here to feel any tenderness there. No? Good. Feels like the liver is 6 under. That's good. Okay, so now I'm going to test the spleen, looking at the top space. So when you're testing for a spleen, you should not be able to palpate the spleen. And I'm going to tap down, and I should hear dull, and I'm going to have you take a deep breath in, okay? So I'm going down here. Okay, now I want you to take a deep breath in. Good, okay. So the top space seems negative. I don't palpate the spleen at all. Next, with the abdomen, I'm going to listen, of course, auscultate bowel sounds, and listen for normal bowel sounds throughout. You sound hungry. Mm-hmm. Bowel sounds all sound normal, active. When I visualize, I look for any abnormal patterns in her stomach. It looks nice and flat. I don't see any bumps, lesions. And I'm going to do light and heavy palpation on your stomach, okay? So just tell me if you feel any tenderness here with light palpation. Okay, I don't feel any masses, lesions. Okay, good. Now I'm going to do a little bit heavier. I'm going to listen for a nice timpani sound throughout. Good. Do you feel any pain when I push in? Okay. Rebound tenderness is negative. Good. Okay. So I'm going to palpate the renal arteries and feel if I can feel that pulsations there, which I really can't. I'm also going to palpate over the aorta, feeling for any bruits or any abnormal feelings, which I can't. I'm also going to palpate, while I've got you here, Melanie, I'm going to palpate your carotids, okay, one at a time. Good. Carotid arteries are nice and intact. That completes the abdominal exam. Now we're going to do the cardiac exam, okay, Melanie? So what I'm going to do is I'm going to take this pillow out. Okay. We're looking at the JVP measurements. JVP is measured basically to see if there is any kind of cardiac enlargement, acromegaly, or distension, through the distension of the veins here. So I'm going to visualize her artery, which is nice and bounding. It looks good. So Melanie, I'm going to raise you up to 30 degrees, and I'm going to look at the changes. Okay, good. Okay, so I'm going to measure JVP. Good. But I don't see any, it's about a 3 above the sternal notch, which is normal, so that means that she doesn't have any type of cardiac, what am I trying to say, any acromegaly or any kind of fluid buildup in her heart, okay? So we're going to go on with the cardiac assessment. So first of all, I'm going to feel over her heart, and I'm going to feel any heaves or bruits over this side, which is fine, okay? Now then, I'm going to listen with my stethoscope to S1 and S2 are normal findings, S3 and S4 are not normal findings. Okay, so second intercostal space. Good. And I'm always going to correlate it with the radial pulse. Good. There's good equal correlation. And while I'm here, Melanie, I'm going to listen over your carotid. Just relax your head. Good. Okay. So here we go. We're going to continue. Tricuspid is at the 4th intercostal space, and then of course the PMI is at the 5th intercostal space, point maximum intensity. Good. If I see any differences in the heart sounds other than what her carotid is, I can always listen to the carotid to see if it's a systolic type murmur. If it's abnormal, it will not correlate with the systolic. The aortic won't correlate with the systolic, okay? So also on a cardiac examination, you want to have the patient turn to their left side to adequately assess for murmurs, because sometimes the murmur is not detected at the PMI unless they're on their side. So go ahead and turn to your side here. And you want to listen with the bell as well. Okay. Good. So it seems that Melanie has a great cardiac exam. I don't see any abnormalities there. Okay. So we've done the head, the eyes, the ears, the nose, the throat. We've done the chest and the thorax. We've done the abdomen. And we are going to go through pulses now. We've tested the pulses here. We're going to check for the brachial pulses. Good and even. And now the radial pulses. Good and even. Okay, and cross your legs. I'm going to feel the popliteal. Good. And then the pedal pulses are good and equal. Okay. So now, Melanie, we've tested for any kind of kidney tenderness, which you did not have any. We've tested all of your pulses, and so now we're going to go through some musculoskeletal exam here. So I want you to raise your arms up. Good. Flip your hands over. Good. And off to the side. Good. And up over your head. And then back. Any discomfort? Okay. So now I'm going to test. I want you to have your arms out to the side. Okay, I want you to push on my hands. Good. All right, and now on the inside. Good, push inside. Good. Okay, good reflexes. There. Okay, now let's do the legs. We're going to test the musculoskeletal portion of the legs. So I want you to bend your knees in, all the way to your chest. Any pain or tenderness? Any clicking? Okay, bend your knee again. We're going to turn it externally and internally. Good. Okay, now on this leg, listen to your chest. And external, internal, extend. Okay, good. All right, now the ankles, I want you to pull up. Good strength, and push down. Good. Okay. All right, it looks like musculoskeletal exam seems to be, and we checked the trapezius earlier when you push up. Good. No tenderness? Okay. Good. Musculoskeletal seems fine. Here in a minute we'll do the Romberg exam and make sure her balance and gait is complete. Let's talk about what we did prior. We did a vaginal exam prior to this, and we noticed that the mucosa was nice and pink. The cervix was nice and midline, and her pelvic exam was within normal limits. We also did a rectal exam. There was no stool in the fecal vault. There was no hemorrhoids, no lesions, and no tenderness in the rectum. So now, Melanie, we're just going to do a quick little test on your. What are we doing here? I want to get something. Oh, we've got this up here. Sorry. Let's do this. I don't want to tear up the flower mound. Yeah, it got stuck on the suction. Put you up here. All right. So what I'm going to have you do, Melanie, I'm going to move the bed over so that we can see too. Okay. So I'm going to have you stand up. Okay. I'm going to test for a Romberg exam. So what I want you to do, Melanie, is I want you to put your hands down to your side. Okay. Look straight forward. Okay, I want you to close your eyes and tell me for 10 seconds. Okay, any dizziness?
No.
No? Okay. Now I want you to walk, just if you could start at the end of the bed and walk heel to toe towards me. Okay. Let's see if we can see you. Okay, heel to toe. Good. Everything looks great. Okay, now turn around and go back. Good, heel to toe. Great. Okay, now stop right there if you can. Now I'm going to have you bend over and I'm going to palpate the spine and make sure there's not any tenderness or abnormalities. Good. Okay, looks like everything's fine. Any tenderness there?
No.
Okay, well, Melanie, that seems that we have completed this exam. Thank you very much.
Okay, thank you.